What's the best weapon in the fight against breast cancer?
Well, it's a combination that we want to prevent breast cancers, and exercise, avoiding excess alcohol, being physically fit. These are all helpful. That may reduce breast cancer by 10, 20%. And certainly getting through treatment and beyond, these are all excellent things, as you just said in the story. But the treatment of breast cancer combined with early diagnosis is really the key to improving the outcomes.
That's right, isn't it? Because lifestyle changes only account for about 20% of cancers if women were to change their lifestyles. But surely what we really need is far more resources directed towards early detection and treatment. Is enough being done in those areas, let's say, first of all, in the West, and then we'll move on to the rest of the world?
There is definitely more work to do. There's been great progress in Western countries. Actually, breast cancer mortality has dropped by 40% in North America and Western Europe since the 1990s. But we've not seen this yet in many low and middle income countries, in sub-Saharan Africa, in Latin America. And what we want to do is learn how we can apply what has worked in high income environments in these low and middle income settings. That's what the World Health Organization is focused on now with the Global Breast Cancer Initiative.
What about stigma around breast cancer as well? We have a report from our colleagues in West Africa, in Togo. They've documented how women there have been isolated in their own communities, have been separated from their husbands after being diagnosed with breast cancer. What can be done to combat that kind of stigma as well?
Well, I think shining a light is part of what we need to do. And you're quite right. There are regions where women are stigmatized because of cancer, the thought that this means that there could be something wrong in the family, when in fact it is the most common cancer, and most women don't have a family history of breast cancer who are diagnosed with it. So helping the communities understand better, this is one of the major goals in addressing those stigma issues. We can't do early diagnosis if the women are fearful and run away. And that's one of the reasons that we see this terribly late presentation of breast cancer in many parts of Asia and sub-Saharan Africa, because they don't come in until it's really late, and the treatment is going to be much more involved and less likely to be successful.
Give us a very quick lesson here, Doctor. What should women be looking for if they're concerned that they may be developing cancer? What kind of symptoms may people notice on their own body?
Well, really, knowing what is normal for yourself is the first important step. And so sometimes women are fearful of touching their breasts, and becoming aware, the breast changes with the menstrual cycle. And so coming to know what is normal for me, so that when you encounter something, you say, this is a new lump, this is a thickening, this isn't the way I normally am, and it persists. That's a reason to come in for a diagnostic workup. And really, the women are the ones, in more than 90% of breast cancers are found by the woman herself in developing countries.
Just finally, can you give us a sense of how concerned men might be about breast cancer?
How concerned? Sorry, say again, please.
Men, sir. Might men also be concerned about breast cancer? Obviously, we're talking about women on the program primarily, but men do get breast cancer too.
Thank you. Well, men do need to be concerned, but only 1% of breast cancers occur in men. They do occur, and they present as lumps, and sometimes they're not recognized because people don't think of breast cancer in the context of men, and they become more advanced. So it's really the same thing. If you notice something new and different, that's a reason to come in and have it evaluated. Much more common than cancers of the breast in men is gynecomastia, which is actually a normal tissue. But they should be aware, and because all of us can be affected by this disease, the most common cancer around the world.
Dr. Benjamin Anderson, thanks very much indeed.